Good afternoon, respected judges and my dear friends. So my talk is on posterior phakic intraocular lens for treatment of refractive amblyopia in children and adolescents. So amblyopia is a neurodevelopmental ocular disease manifested as monoocular and binocular impairments, including vision reduction, contrast sensitivity, and loss of stereoscopic vision. And commonness of amblyopia is classified as refractive, anisometropic, and isometropic. Occlusion therapy has its own problem with recurrence of 25 to 50%, and contact lenses too has a problem of poor compliance and intolerance. So this was the first clinical trial registered with NIMS ICMR. So we used the phakic IOLs in children and adolescents of 10 to 19 years. As per literature, this is the first world such study with this much of sample size and in this age group. So its purpose was to analyze the demographics and clinical outcomes of posterior chamber phakic IOL for refractive amblyopia in children and adolescents. This was our methodology: prospective international study on children and adolescents with amblyopia at a tertiary eye care center from January 21 to January 23. 23 eyes of 21 anisomyopic and isomyopic amblyopia patients operated for phakic IOL as a treatment for amblyopia were included in this study. Patient demographics: pre and post-operative visual acuity, cycloplegic refraction, anterior and posterior segment examination, IOP, pachymetry, contrast sensitivity, endothelial count, stereoscopy, and patient satisfaction scores were evaluated. And inclusion criteria: stable refraction, and the patient who were not improving with the occlusion therapy, and contact lenses, ECD of more than 2500 and ACD of more than 2.8 millimeter. Patients were followed up day 1, 6 weeks, 3 months, and 18 months after surgery, and all the records were documented. Exclusion criteria were patients with hypermetropic amblyopia, strabismic amblyopia, or with any history of glaucoma, active inflammation, cataract, previous intraocular surgery. These were our results. Demography: the mean age was 14.16 plus minus 3.49 years, and 52% were male and 47.83 were female. And this table depicts the mean and standard deviation of preoperative vision uncorrected to last visit. So preoperative uncorrected distant visual acuity improved from 1.39 to 0.17 with a significant p-value, and the preoperative best corrected distant visual acuity also improved from 0.40 to 0.11 logMAR. And this table depicts the uncorrected visual changes from preoperative to third visit after operation. So this is the mean difference. So preoperative vision 1.11, so it improved to 0.05 with a significant p-value of 0.003. And in terms of gain in visual acuity lines, the uncorrected visual acuity and the best corrected visual acuity during the post-op visits. So from day 1, uncorrected visual acuity, the gain was 11.3 and it improved to 12.1 at the last follow-up. And the best corrected visual acuity also improved from 1.3 line to 2.6 logMAR lines. This table depicts the comparison of contrast sensitivity that also improved from 1.07 to 1.66 with a significant p-value. As we compared the IOP, there was no significant p-value difference. It remains the same from 15.25 to 15.29 at the last visit. And this table represents the preoperative and the postoperative endothelial cell count. So there was a loss of 5.78%. And on the Likert scale, this was the patient satisfaction rate. 74% were extremely satisfied and 24% were very satisfied. As we compared the stereo acuity, so this was most plastic and rigid to improve. So from more than 800 arc second of mean, it improved to 150 at the last visit, and only at the last visit there was a significant p-value difference. So in the discussion part, so AIOC, they have done the same thing for the treatment of anisometropic and amblyopia in children. They have a longer follow-up, but it was a retrospective study and they included lower age group with a sample size of 11. As compared to the SLKK study, they used the varus eye ACIOL, so it has own complications. Zhang et al., they also used this technique, but the sample size was 11. So in conclusion, phakic IOLs can be a preferred choice for management of amblyopia in children with no incidence of corneal haze and ectasia, good refractive results with stability and good quality of vision, faster visual recovery with flat learning curve, no PI is needed in newer designed phakic IOL, more multicentric clinical trials with long-term follow-up are needed for results to be more conclusive, and stereopsis takes longer time to improve. So sometimes opting for the simplest of the surgical procedures, we are able to treat the most complicated of the problems. Thank you. Thank you so very much.
Two, three just comments. You have included the patient till January 23.
Sorry?
January 23. You have in your inclusion criteria, all the study material in the patient
No,
recruited,
the follow-up.
but follow-up till January 23.
Yeah.
But you have submitted your paper probably in August, September.
So we have included the changes which has happened.
Anyway, and the second one is you have not mentioned how many patients actually completed the third follow-up visit, how many patients has, then the statistical points actually mean something. Otherwise, there is nothing written there, how many patients completed first follow-up, because this is a problem in India, how many patients completed the fourth visit. And again, another point is you have not grouped all the patients because you have a different age group. It is better to understand because these are amblyopic aged patients. So we know that the earlier we intervene, the better
Yeah,
the
definitely.
result. So you have a large. So my suggestion will be that you should group this like so that you can understand better which group are actually improving so much, or which group you have generalized everything.
We have included only the isomyopic and the anisomyopic type of patients.
Age group of the patient I am talking.
It was mean age of 14.15.
No, I'm not talking about mean. If you take from 6 to 14, then you should have 2-3 groups because they are growing age. So there might be some different in understanding how some people are, some child are actually improving. Some of it when you group together, then average figure doesn't mean anything
Yes,
actually.
10 to 19 years.
10 to 19 years.
Yeah.
Okay. Any question? Okay. Thank you.
Thank you, sir.
Thank you.